Good morning. My name is Emily Gutke, and today's topic is on PID. So, PID is pelvic inflammatory disease. It occurs when there is inflammation of the upper genital tract. Now, PID is most common in women, so some structures that may be affected would be something like the ovaries or the fallopian tubes. So, PID is most commonly caused when gonorrhea or chlamydia are left untreated. However, there are numerous risk factors that could make someone susceptible to getting this disease. As a nurse, when we're assessing patients, we want to assess some of those risk factors. Again, since chlamydia and gonorrhea are one of the most common causes, we would want to know about their history of STIs. Have they had any STIs before? Have they had PID before? We would want to know if they have any STIs currently. We also would want to know about testing. Are they getting STI testing done? And if so, how frequent? We would also want to know about their sexual activity, their partners. How many partners do they have? Does their partner have a history of STIs? Have they had PID before? Does their partner currently have any STIs? And a big factor is prevention and protection to protect against contracting any STIs. So we would want to ask about protection and contraceptive devices. Are they using any protection? Are they using any contraceptive devices? And if so, what are they using? Because some contraceptive devices only protect against pregnancy. Some of the hormonal choices, such as the pill, only protects against pregnancy. And if we are given this information, then we know that we need to educate that if they're only using, say, a hormonal form, that we need to educate them to a barrier form such as condoms should be used in addition to help prevent and protect against any STIs or PID. Another reason why we would want to know about contraceptive use is because IUDs actually put someone at risk for contracting PID. So when the intrauterine device is being placed in the uterus, they're introducing the uterus to possible new bacteria. If that area has never had that bacteria in it before, it's going to spur that inflammation process it wants to get rid of that bad bacteria, that abnormal bacteria. So it's going to cause the inflammation process to flare up, and it's going to cause this disease to occur. So if an IUD has been put in within 1 month, then they're at risk for PID. We would also want to know about personal hygiene practices. Are they practicing vaginal douching? Vaginal douching, again, will introduce, if you're spraying things up into the vagina, it could introduce new bacteria and, again, cause that inflammation process to occur. Lastly, we would want to know about any smoking, recreational drugs, and any alcohol usage, because too much alcohol, smoking can damage your body and inhibit the body's ability to fight off infections and also increase one's susceptibility to getting infections. So, how do we diagnose PID? According to the CDC, a patient must present with lower abdominal tenderness, bilateral adnexal tenderness, and cervical motion tenderness. Patient may also experience vaginal discharge, fever, nausea, vomiting, or abdominal pain. However, labs and some diagnostic tests can be run to validate this diagnosis of PID. So some labs that could be done would be the erythrocyte sedimentation rate. An increase in this sedimentation rate is indicative of inflammation. The C-reactive protein level is another test that can be done. And again, an increase in these levels is indicative of inflammation. So it lets them, the provider, know that something's definitely going on because these levels are elevated, which means there's some type of inflammation going on inside. A vaginal smear test could also be done. If there are white blood cells present in the on the vaginal smear, then again, that is also indicative of an inflammation in the genital tract. Again, since chlamydia and gonorrhea are one of the most common causes, they may do a culture and a probe for either one of those STIs. So they might run a culture for chlamydia or gonorrhea to see if they have either one of those STIs. Lastly, a provider may do a laparoscopy, which is gives them a visual of what's going on inside. And if they would like, it even offers them the opportunity to get a tissue sample while they're in there of what's going on of the tract. They could get a tissue sample of it, so for further testing. Lastly, as a nurse, some interventions that you may do would be to maintain IV fluids. We want to make sure the patient is staying hydrated and taking care of themselves. We would also want to monitor pain, give pain meds if they need, because again, that inflammation could cause them some pain. So we would want to give them pain meds if they need them. And definitely antibiotics. We definitely want to provide the antibiotics to help fight the infection and help decrease the inflammation, help it go down. If the patient was hospitalized, we would want to put them in semi-Fowler's position because that would help to drain any fluid that had accumulated in the pelvic area due to the inflammation. And lastly, we would want to just educate, because we want to prevent this from reoccurring, and we also want to prevent it from spreading. So very important education would be to make sure they know that they need to tell their partner that they were diagnosed with PID, because then the partner, their sexual partner, also needs to go and get tested for PID so they can be treated as well. If PID is left untreated, it could have some serious complications and even be life-threatening. So it's very important that as a nurse, we stress patient understanding, and we stress how important it is to go get tested. And if the patient thinks something is wrong, we stress that it's important that they go get tested so that they can be treated, because some of these STIs, they can really develop and they can grow, and even if the symptoms may not be too bad, it can cause some life-threatening issues and cause some complications, and may affect fertility in the future if that person wants to have kids. So making sure the patient understands the seriousness of STIs and this disease is very important as a nurse to help prevent the spread and prevent any other possible diseases or complications with this disease. Thank you.